Good morning, everyone. Bore da. Diolch yn fawr am ddod heddi. Thank you very much for coming this morning to this training day. I cannot believe that it's 12 months since we were at the Cardiff City Stadium. I think that day we even had a little bit of snow and inclement weather, which might have prevented some people from attending. Little did we know that in 12 months' time we would be having to do this meeting where we're looking at each other as if we were on postage stamps. But here we are. I suppose there are positive signs to the pandemic and there are negative signs still very evident. So I am very grateful to every one of you for making the effort to come today. Unfortunately, I cannot stay. I will be dipping in and out. My son and his wife have got important meetings today, and therefore I have got some childcare responsibilities. And a 5-year-old and a 2-year-old probably do not want to be involved in the AWMSG training day. They would contribute, but probably not in the way which you were expecting. So please forgive me. I will be dipping in and out when the opportunity arises. Next slide, please. Just to confirm that AWMSG reached adulthood last year. I don't think it expected to move into its 18th and 19th year, having to do things in such a different way. But when you look at the legacy of this organization, it is quite remarkable. And in terms of the guidance, appraisals that have been undertaken, the strategies that have been produced, and the intelligence that has been accumulated over time. And the expertise and data that now exists in Wales is due in no small measure to the efforts, energies, and skills of colleagues in AWTTC. Next slide, please. So I was appointed as chair of AWMSG in July, August 2019, and was issued with a remit letter, which in a sense forms the basis of my relationship with the minister and through officials to the minister. I was reflecting over the first 6 months of my time as chair as to what had been achieved and what we needed to do in moving forward. The number of appraisals was being reduced for a number of reasons, and not to say that the quality of those appraisals in any way was diminishing. However, the number and the significance of them was taking on a different dimension. There were major issues facing NHS Wales, and especially around medicines management, and that's pre-COVID, remember. So I was cognizant of the fact that we had to address some of those issues, and so I did quite an extensive round of conversations with various stakeholders and individuals and groups, and was conscious that the strategy of AWMSG needed to be refreshed. And as part of that, we needed to work on the program of projects and schemes, etc., that we needed to embrace. And the role and relevance of AWMSG also needed to be given greater dominance and greater increase the awareness of its role, its function, and its purpose, but also what it could contribute in regard to medicines management across Wales. Thank you, Laura. So the three aspects of the remit letter, and I'm sure everyone would say amen to each of these, is delivering better outcomes for patients, reducing harm, improving medication safety, and supporting the delivery of value-based healthcare. And everything that we do, and that is done by AWMSG and its constituent committees, has to fit in and align with these particular objectives. No one would dispute that we need to deliver better outcomes for patients. We need to improve medication safety and reduce harm, but also cognizant of the fact that we only have limited resources. Thank you. So I've tried to involve as many people in my conversations. This is a diagram of the stakeholders that we try and engage with, as well as having the initial conversations. I do try to get around as many of these other stakeholders on as regular a basis as possible. And when I say I get around, it means I join various Zoom meetings and team meetings and so on, whenever possible. Thanks, Laura. So the key objectives in moving forward are to shape the medicine management agenda in Wales and the implementation of AWMSG strategy, provide strategic direction with regard to the NHS regarding medicines management, trying to develop innovative partnerships. For example, the relationship that we have with NICE is being refreshed with a new Memorandum of Understanding, and that will be taken forward over the next few months. Obviously, achieve the best outcomes from the use of medicines, and that's not just new medicines, but looking at medicines in general. And ensuring that AWTTC supports the committee and Wales in achieving its strategic objectives. And that has been very noticeable, the way in which AWTTC has become much more agile and reflective and proactive, especially during the COVID period, where the new things have been done in a new way, and new things have been done differently as well. So I think it's all very positive in relation to what has been accomplished in the last 8, 9, 10 months of the pandemic, and that is indicative of what can be done in moving forward. Thanks, Laura. So yes, 2020 was dominated by coronavirus. Thank you. We held 7 meetings, which is remarkable in and of itself. What we had intended to do was to take AWMSG around Wales. That was not possible, obviously, but we have managed to get involvement from virtually all of the health boards in our meetings, and the conversations and discussions have been extremely positive. And the feedback from AWMSG members has been positive, but also those colleagues from the health boards have benefited from the conversations, and discussions are taking place now on a regular basis outside the meetings, so that the medicines management agenda can be developed and best practice can be disseminated, and we can learn from each other and so on. There have been a series of publications and resources which have emerged during the past 6 to 10 months. National prescribing indicators is continuing to be monitored as to its appropriateness, its relevance, and taking things forward. During the course of the year, 14 appraisals were undertaken and 93% were recommended as positive to take forward and be prescribed in NHS Wales. And of course, we are monitoring the new treatment fund. Thank you. The new website was launched in the summer, which was again something to celebrate. The process for appraising paediatric license extensions was approved by AWMSG in December, and that is a significant move forward. I've mentioned the representation from health boards. We are going to have a series of training days virtually, rather than just perhaps a big bash. But so there will be specific bespoke training days put into colleagues' diaries. The development of a medicines optimization framework is in progress, and that is really exciting there. We're looking as well, and I'm not keen on the term disinvestment, but it means those medicines which do not provide good value are being looked at and explored to see if the resources currently allocated to the provision of those can be better placed elsewhere. There's a plain language document on the AWMSG website to explain how medicines can be accessed within NHS Wales. And of course, we are complying with the developments and requirements of the Welsh language. Thank you, diolch. We're aligning ourselves with NICE regarding the methodology and prescribing guidance, and that work is ongoing. We're supporting the implementation of Blue Tech high-cost drugs platform and conversations with WISC in that regard, and that is an exciting development. We're providing up-to-date, timely advice on new medicines and medicines of low value, and working closely with the Chief Pharmaceutical Officer in Welsh Government to ensure that colleagues are up to date. We're desperately trying to improve stakeholder and partner engagement, and I think we're on the right track there. And AWMSG goes global because we will be co-hosting the 2021 Health Technology Assessment Conference. Thank you.